So Novak Djokovic recently retired from the Australian Open and then posted a picture on his social media handles saying that he'd suffered a hamstring tear. I'm attaching that image of the MRI here.
We know that fat appears bright on T1 as well as T2 sequence. So this is an MRI image of a normal person and we can see that subcutaneous fat is bright. Whereas the MRI of Djokovic shows very little subcutaneous fat and the signal is suppressed. So this is T2 fat suppressed sequence in axial section of the thigh. These grey structures are the muscles and this black area is the cortex of femur, inside which this is the bone marrow. You can observe that there is T2 hyperintensity in this muscle, which can be due to accumulation of fluid or subacute blood. So this grey structure is actually the muscle fiber, but posterior to this we can see some discontinuity in the muscle fibers, and in between these discontinuous muscle fibers we can see accumulation of fluid or subacute blood. So this suggests that there is muscle tear, and to know the complete extent of the muscle tear we need the coronal and sagittal sections also. We know that in thigh there is anterior, medial and posterior compartment. So this yellow one is a rectus femoris muscle in anterior compartment. This pink one is sartorius, which is located medially. With orange color I have shown vastus medialis, red one is vastus intermedius, and on the lateral aspect we have vastus lateralis. Medially this sickle shaped muscle is actually gracilis, and with brown color I have shown adductor longus, and with yellow color I have shown adductor magnus, which is actually torn in this case. In the posterior compartment we have hamstring, which constitutes biceps femoris, then semitendinosus, and medially with green color I have shown semimembranosus.